Hello and welcome to the Recovery Channel. I'm Dr. Richard Whitney, Medical Director of Addiction Services of Shepherd Hill in Newark, Ohio. We're talking about opiate abuse and addiction. There is a difference between these two. People essentially who abuse opiates can stop and stay stopped. People who have progressed to the disease of addiction cannot stop without help. So there are differences. Some people get high a few times and stop. Other people, once they get hooked on opiates, they can't stop without help. It's a terrible disease and one that really needs intense treatment to get people help. Well, why do people use opiates? That's what a lot of loved ones and police officers and judges and reporters want to know. Why is it that people use opiates? Most people that I see, and I've been in this field of treating people with alcohol and drug addictions for well over 20 years, and I've never once seen a person who said that my life's ambition was to become a drug addict. It does not happen. And we're talking about upscale, highly intelligent, successful people, doctors, lawyers, dentists, pharmacists, business owners, who also have other medical diseases like asthma, diabetes, and cancer, and who also have a brain-based disease called addiction. In these individuals who are genetically predisposed, the other risk factor being early onset of use in early teenage years, so the combination of early use in a non-mature brain and genes that we cannot help but inherit from our parents, cause people when they're first usually prescribed opiates, sometimes they get it from friends, but very commonly prescribed for a twisted ankle or a broken leg or a severe cough. And what they find is, wow, these chemicals really make me feel good. Oh, maybe I'd like another one. It relieves my pain, but golly, it makes me feel fantastic. And once the prescription runs out, they say, God, I don't really feel as good. I would really like that pleasurable experience again. Just like a drink of alcohol, just like a hit of marijuana or a cigarette smoke. So people say, Doc, my ankle still is pretty sore. Can I have a refill of that prescription again? They have progressed to the want stage. They are now abusing the drugs. What does abusing mean? It means they're misusing it for non-therapeutic purposes. I am taking this prescription drug because I want to feel high. Not because my ankle really hurts, because I want to feel high. And at this stage, people say, I can take it or leave it. I kind of like to pop a couple of Percocets and then go to work, or pop a couple of Percocets and then go out to a concert, but I can stop anytime I want to. Then an invisible line is drawn and then crossed, and people all of a sudden find themselves in the disease of addiction where they need the drug, they crave the drug when it's not in their system, and they can't stop despite problems associated with their drug use. So it's a progression from like to want. People can still stop. Once they go to addiction, people need help to stop because the disease takes over every facet of their life, and people spend all of their time obtaining, using, and experiencing the effects of drugs, and also because they go into opiate withdrawal. After a period, sometimes of just a couple of weeks, people taking opiates, right, whether they're snorting heroin or taking Percocet or whatever they're doing, find that when they don't have it within a few hours or a day of their last dose, they go into withdrawal. And imagine the worst case of the flu you ever had. You're vomiting and you're diarrhea, belly cramps, sweats, fever, headache, aches and pains. You just can't get rid of it, and you feel so bad. It won't kill you, but you just wish you were dead. And you say, I'll do anything to get rid of that feeling. And what that anything is another hit of heroin, another Percocet, another Vicodin, another Dilaudid, whatever's available. Now what happens is, in this little video, you see there's a part of the brain called the locus ceruleus. All that means is that this part of the brain stains blue if you take a brain out and put it in a chemistry lab. But what happens is, after a period of time, this chemical called norepinephrine, which is like adrenaline, is pouring out into the brain, and people feel shaky and absolutely horrible because of this chemical and opiate withdrawal. It's an actual brain chemical effect of an overload of putting your foot on the accelerator as fast as you go. And people know that this opiate that produces this wonderful feeling of euphoria and relief will stop this effect of withdrawal. This is all about nerve cell to nerve cell stimulation from this chemical norepinephrine, again, just like adrenaline or epinephrine. And this overstimulation causes this horrible bout of withdrawal, and people will do whatever they have to do to stop that effect. Now, the worst part of withdrawal is over just a couple of days, but protracted or long-lasting withdrawal can go on for weeks to months. People say, why can't you stay off of drugs? You got over withdrawal, you've been detoxified, you haven't used in a week, you're over the worst part of it. What's wrong with you? The answer is what's called protracted withdrawal syndrome. Okay? What this means is that people's brains have been so altered from the use of these drugs that their protracted withdrawal continues to cause issues and continues to cause physical problems with their body and their brain. This can go on for several weeks, and the most number of people relapse and go back to their drug use in the first 3 to 6 months. Why is that? Oh golly, I've got no energy, I can't get any pleasure out of life, I can't sleep, my appetite is terrible, I've got mood swings, all I can think about is drugs, my body hurts, sex is not important to me, I have no desire to have any sex at all. If this is as good as it gets, I might as well go back and use drugs. And guess what? People do. How can we help people to stop and stay stopped and not go back and use opiates? We're going to talk next segment about how we treat patients and individuals and loved ones who are addicted to opiates.